welcome to another episode of the White Cataract series with male Brunescent Cataracts presented by Odox Eye Care. With this, we're trying to show that the challenges obviously with these are poor red reflex, a high risk of AC rent or an Argentinian flag sign, the high risk of wound burn, damaging the cornea and causing endothelial dysfunction, and the high risk of PC tear and variability and refractive outcomes. So these can be quite challenging cataract repairs to do. So this case was performed under local anaesthesia with the subtenons lignocaine 2%. And as we've shown here, we've demonstrated the paracentesis wounds created early and vision blue dye injected into the anterior capsule to easily visualize their capsule. We then wash out the dye with a balanced salt solution and aim to inject a high molecular weight viscoelastic such as Helon 5 to form the anterior chamber and flatten the anterior capsule out as we see the main incision wound being made. We insert a 27 gauge needle to decompress the lens, which is very important to avoid uncontrolled AC rent, which can lead to the Argentinian flag sign which we mentioned before. We begin to create the continuous curvilinear capsule Rexus by using a needle cystome. We then complete the Rexus with a Rexus forceps. And you see here the Rexus is initially started with the cystome and then the Rexus forceps used to complete it as we go around to create the full capsule Rexus. Now ideally the original size that we want to try and get to is about 5.5 millimeters. And as we see here, this is more like 5 millimeters, so a little bit smaller than was intended. The next part is to do a good hydrodissection, just to ensure that the nucleus is rotating freely within the bag. Once the hydrodissection is complete, we can then use the sculpting mode on the Phaco to make a groove in the centre. And as you can see, again, another very brunescent white cataract. The nucleus is then rotated 180 degrees to lengthen the groove, and we're able to split the nucleus in half. And then we do the chopping technique. So using the second instrument, the chopper, we split the halves into quarters and then we phaco emulsify the cataract using ultrasound waves and suction. In between, we top up the viscoelastic to protect the endothelium, and we use Visco coat to coat the endothelium in this example. And we do have to be careful at the end, as the last quadrantal piece of the cataract are the ones at highest risk of accidentally rupturing the capsule. The remaining cortical materials are removed with bimanual irrigation aspiration probes. And then just before we put the intraocular lens in, we'll inflate the ACM bag further with Helon and viscoelastic. And now a DCB00 Johnson & Johnson clear intraocular lens is inserted. So as the lens is correctly placed, the remaining viscoelastics are removed with the INA probes. As we get to the end of the procedure, the wounds are then sealed with further BSS, and subconjunctival Kefsol and dexamethasone was injected as well. Once again, these cases were all completed without any complications. And were performed by our co-founder and director, Dr. Hong. At Odox Eye Care, we're trying to increase accessibility and affordability of eye care by creating an ecosystem with smartphone-based technology so that people can have better access to eye care and eye health. And you can see us at our website at odoxtech.com.